You shouldn't be going to work wondering if you're going to make it home safely, if you're going to be returning to your family, or if you're going to end up in the hospital yourself. As a medical provider or a healthcare worker, we go to our jobs to try to help people and help figure out what's going on and to treat them to the best of our abilities. But it's a very tough job, and there are so many variables beyond our control. But unfortunately, as hard as it is to work in healthcare, it's getting even harder due to workplace violence. According to the Bureau of Labor and Statistics, healthcare workers and the social assistance industry, which includes things like social workers, is the industry with the highest amount of non-fatal workplace violence. Their records show that in 2021 and 2022, there were almost 42,000 incidents of workplace violence across the whole country in all industries. But you'll probably be surprised to learn how many of those 42,000 incidents occurred in healthcare and social assistance industry. What are you thinking? Maybe like 30%, maybe 50%? How about 72.8%? That's right, almost 73%. And these are just the reported cases. We know how many cases go unreported all the time. Plus, it's difficult when you're dealing with patients who may be in a very distraught state of mind or just may have some cognitive impairment going on because of their conditions. Whatever it is, it's difficult in medicine, and we have to have a little leeway there, right? Because what we deal with. But still, accounting for almost 73%, that is just mind-boggling. It is far and beyond higher than in any other industry. And unfortunately, I think it's only getting worse. People are way more distrusting of healthcare professionals. They have very little respect a lot of times for us, and they are not afraid to be very vocal and violent with us at times. And you may think I'm kind of exaggerating or just saying it's worse because I am a healthcare worker. But if you look at this graph, also from the Bureau of Labor Statistics, from the same time period, it shows you the increase in violence against healthcare workers. And then it also shows you all other industries and the increase that they have experienced. So yes, they all have experienced some, but as you can see, altogether, no one has experienced anywhere near the increase in workplace violence as medical professionals, as healthcare workers. So I hope that it's obvious to see that there is a definite problem here. So that begs the question, like, what are hospitals and healthcare organizations doing to protect us, and are they doing enough? Well, we're going to kind of dive into that, but before we do, I just want to highlight a couple incidents that have happened so far in 2025, and we're only a few months into the year. First, let's look at the recent case that happened in late February of 2025 at UPMC. So this happened in the ICU. Many of the staff were taken hostage by a gunman and had their hands zip tied behind their backs. When all was said and done, the gunman was killed, but a police officer also died. 2 other police officers, a doctor, a nurse, and a custodian were also injured. A nurse who survived the ordeal shared what happened on social media. And she says that she was held at gunpoint with her hands zip tied behind her back and actually used as a human shield for the gunman as he was approaching the police officers. She said she was begging for him to let her go, but his response was to stick his gun in her spine and up against her neck and threaten her more and push her in front of him. I mean, that is just a harrowing experience and something that you don't anticipate happening when you go to work in the morning, right? She went on to say, "My physical injuries do not even compare fractionally to what injuries are unseen." Meaning she has got this psychological injury and this PTSD that is going to last her lifetime, undoubtedly. Lester Mendoza, who is a PA in critical care there at UPMC, shared his thoughts about this incident. He said, "I was there when we delivered the worst news imaginable to him," meaning the attacker, that his loved one was gone. "I saw his devastation firsthand. In that moment, I truly did not see a monster. He was simply broken. I would have never imagined or expected him to do something like this, But grief, exhaustion, isolation, and a lack of mental health and social support services create cracks that people fall through. And when they do, the consequences can be catastrophic. And as a side note, I did see in one of the articles that I read that somebody who knew the attacker previously said that he has suffered with some mental health issues in his life. Mendoza went on to say that this isn't just about one tragic event. It's about a system that is crumbling under neglect. We are all exhausted. We are all suffering. And if we continuously ignore it and accept it as the normal, there will be no positive growth or change. Very important point. We have accepted it as normal for too long. He continued by saying, we are working in a system that is stretched too thin. The medicines and supplies are too expensive. Insurance companies more relentless than ever. Absolutely. Unsustainable staffing and turnover, excruciating wait times for care, and lack of beds puts stress to move others out and get others in. We are expected to provide limitless care with limited resources. We are asked to carry the weight of life and death, grief and loss with little support. The longer we are stretched thin, the more we risk becoming numb, jaded, and detached. Not because we don't care, but because we are drowning. I think he said all of that so very well and sums up what a lot of people in healthcare are thinking and feeling. Now, UPMC put out a statement, but they didn't say too much. I assume that's because they're probably trying to limit their liability. They did say things like that they are reviewing the incident and going to look over their security policies and procedures to identify areas of improvement. I don't know about you, but for anyone that has worked in healthcare, all of 5 minutes can probably identify off the top of our head the areas that need improvement, the things that we can do to make our jobs better and our workplace safer. It doesn't need a study, right? We don't need to spend years trying to figure out what the problem is and then talk about fixing it. The problems are evident. And the problem really comes down to the fact that it's going to take money to solve these issues, and no one wants to part with their money. Now, UPMC is a nonprofit organization, but that doesn't mean that there aren't people that are profiting from this organization. And they did report for last year operating losses, but they also generate billions in revenue and have significant investment income. And they do have the financial capacity to make vital safety improvements at their facilities. Now, it's harder with a nonprofit because we can't focus on a profit number, but to kind of prove the point that they do have money that could be allocated, let's look at the salaries that some of their executives are getting. Their current CEO received over $11 million in compensation in 2023. $11 million. But at the same time, and what's even more egregious, is that their former CEO, who retired in 2021, UPMC paid him nearly $18 million in 2023. I'm assuming that was part of his severance package. In addition, several UPMC executives make well over $1 million a year. So I believe as a nonprofit, the funding is there, that they could improve safety. I think it's more of a question of where their priorities are. And I'm not trying to pick on UPMC. I know that they are not the only organization that is doing things like this. Now let's look at another horrific incident that has occurred in 2025. This happened just a couple weeks ago in early March. A 67-year-old nurse was attacked by a patient at HCA Florida Palms West Hospital. She was attacked so violently that nearly every bone in her face is broken. She has bleeding into her brain and her collarbone was broken. The injuries are so bad, they don't even know if she will ever see again. After the incident, she was in critical condition. It's my understanding that she is still in the ICU but is improving, but still requiring ventilator support. So a very violent and brutal attack. Now, the patient who attacked her was in the hospital on a Baker hold. It's my understanding, I think this wasn't really clear, but that he was put in the regular hospital because he was complaining of a medical condition like chest pain. Now, just a side note, I think it's really weird in our society how we have mental hospitals and then we have hospitals for all other physical ailments, how we've kind of separated those two, as if a patient couldn't have and doesn't often have a combination of physical and mental complaints. And our system is just not set up to handle that. So instead of going to a psych facility where they may or may not have had adequate staff to watch him and guards there, he was sent to the regular hospital. And also, is my understanding that the hospital was packed as usual and that the patient was in a room all the way at the end of a hallway very far away from the nurse's station and other employees. And this poor nurse, it was her job. She had to go take care of the patient, was in the room with him. Something happened and she was violently beaten. And I'm sure that all of you join me in sending our thoughts and our prayers to her and our hopes that she is able to recover from this horrible attack. So what was HCA's response to this attack, you might wonder? Well, very similar to UPMC's. They don't say a whole lot. They, again, are protecting themselves liability-wise. But of course, they expressed their concern and their support. They reaffirmed their commitment to safety. And HCA also stated that they have security protocols in place and that they regularly review and update those protocols. However, for years, HCA staff and workers have been criticizing them regarding the perceived lack of adequate security measures at HCA facilities. They've voiced their concerns over the staffing levels and how thin everyone is stretched there. And there have been many calls for stronger security measures, such as increased security personnel, metal detectors, and improved training for staff at HCA facilities. So maybe HCA has wanted to make these changes. They're obviously aware of them, but maybe HCA just didn't have the money in the budget. Well, let's look at their financial situation because unlike UPMC, HCA is a public company and we have access to their financials showing the profits that they have made. So how much do you think they made in profit in 2024? Well, it's not quite as much as the insurance companies, who make 10, $20 billion a year. No, poor HCA only made $5.76 billion last year. So, as you can see, they clearly have no money in their budgets. Think about it, $5.76 billion. We're not talking in the millions, we're talking billions with a B. Now, how about the executives at HCA? How much are they making a year? Well, the CEO last year of HCA brought in a mere $23,799,137. And that was up almost $2.5 million over 2023's compensation. Unless you think it's just their CEO that is overpaid, let's look at 4 of their other top executives. The CFO got $4.6 million last year. The COO, Chief Operating Officer, got $9.1 million. The Chief Legal and Administrative Officer got $5.7 million, and the Chief Clinical Officer got $5.5 million. So, yeah, this is not a struggling hospital system. This is an ultra-profitable corporation. They spend millions on stock buybacks and executive bonuses every year. Imagine if just a fraction of that money was used to help the employees that are making them those billions of dollars. The cost of installing panic buttons, hiring more security, or staffing at safe levels is just a drop in the bucket compared to the compensation and the profits being made. I don't know about you, but I'm really tired of these healthcare organizations crying that there is no money in healthcare, telling us all the time that they don't have the money to staff adequately and to make do with whatever supplies you have. When we find out that the executives are raking in the big bucks and that there is plenty of money going around, just not for the healthcare workers, for the patients, and for the actual facility itself. So really what it comes down to is greed. Pure and simple, there is money there to fix these problems. So you may be thinking to yourself, well, those are some pretty extreme, isolated incidents. Is it really that bad in healthcare? And if you're asking that question, you probably don't work in healthcare. But I would say on the regular, healthcare workers are being yelled at daily, being cussed at, being called liars and told that we are incompetent or we are in bed with big pharma trying to keep them sick. Whatever it is, we hear that all the time. That's nothing new. But beyond the verbal abuse, healthcare workers are also being punched and kicked and bit and spit on. And on top of that, we are regularly receiving bodily harm threats and death threats. And I'm not exaggerating when I say that. I believe that every day in thousands of medical centers across the country, healthcare workers are being threatened with their lives. I'm one of them. I have a story to tell. It was my very first year working in healthcare. I was working in a rural family practice office in a small town that had limited healthcare resources. And one of the clinics in town was closing down. I believe the doctor was retiring. So we were scrambling to take in as many of those patients as we could, but we were a very small office already filled to the gills. And this man was irate that we couldn't see him for like a couple of months. We weren't going to be able to get him in till then. And he was yelling at the front desk and cussing at them and told them that he is going to look up the providers on the website and he is going to kill every one of them if we don't get him in and see him. And this was a small town. It was not hard to find out who we were and where we lived. And was he just blowing off steam? Probably. Nothing ever came of it. None of us died. But it's still a death threat and it still affects you. The police were called. They looked into it. I don't know that anything ever came of it. He certainly didn't become a patient of ours, but it was just kind of dropped. It just kind of ended up being just something that happened and no big deal. We weren't escorted to our cars that day. No one checked on us later. There was hardly even any talk about it in the office after the next day. It was just another random death threat in another random medical office around the country. But you tell me, if you're watching this and you work in healthcare, have you experienced threats? Have you experienced violence? Share your experience with us down below in the comments section. I'd really like to see what other people are going through. I know that it's happened to many people because I read about these things in forums all the time. So what can be done? Is there anything that can be done? Is this just going to continue to get worse and we just throw our hands up in the air and say, oh well, and just accept it as our new normal? Well, there are lots of things that these organizations and facilities can do. One of them is having a stronger security presence. I hate to say it, but we need to have armed guards and have them trained in how to de-escalate these situations and have more of them in our facilities. Not only would they be there to help us if something happened, but they would be there as a deterrent as well. We need to have weapon screenings, metal detectors, something like that, like they do in courthouses. When I was talking about reading things on the forum, I saw several PAs talking about how they've gone to examine a patient and discovered that the patient had a gun, that there was a concealed weapon. Now, most of these things where they found weapons were on people who are law-abiding citizens and who just happen to have a concealed weapon on them. But still, you're in a small room with the door closed, just you and one other person who is armed with a gun, and you may be telling them information that they don't want to hear. They may be having some kind of condition going on where they're not exactly in their right mind. You don't know. We are in a very intimate space, and in my mind, that is just not a good situation. I don't believe that people should be able to bring weapons into a medical facility. I also believe that every person who is employed in a medical facility, so this includes providers, nurses, front desk staff, custodians, whoever it is, they should have a panic button that they wear. We should be able to alert other people and hopefully summon help by those armed guards if there is a situation that happens, and that people can know about it instantly and get there to prevent serious injury. We also could have stricter visitor policies. They do this in children's hospitals. Usually they limit the amount of people and you have to sign in and show your ID and get a little sticker saying that you are a registered visitor there. Having less people coming and going limits the amount of people who could just walk in and harm other people. There needs to be better reporting and accountability. These organizations need to have strict reporting policies. It needs to be reported the same way every time. All the information needs to be gathered. And the policies of the hospital need to be clearly communicated to patients. They need to set clear boundaries and have these zero tolerance policies and actually enforce them. And finally, there should be mandatory de-escalation training, good quality de-escalation training for healthcare workers, as well as self-defense training. None of these fixes are earth-shattering. It's not anything new. I'm not saying anything that is creative and hasn't been said a million times. It's just that they just need to be implemented by these systems. But until that happens, what can we do? What can we do as healthcare workers to protect ourselves and to push for these things to happen? Well, the first thing is that we need to use our voice. We need to all be talking to hospital administration, asking them the what if scenarios. What's in place? What are the protocols? And is this being talked about? Are there further security measures that are going to be implemented that are in the works right now? And if there's not, we need to speak up about that and we need to express our concern. Beyond doing that individually, we also could consider joining or supporting worker advocacy groups or unions. There are organizations that are fighting for hospital workers and for healthcare providers' safety. And in addition to that, you could contact your lawmakers in your state. Several states are considering implementing workforce safety laws specifically for hospitals, and contacting your legislators and sharing your experiences could really help reinforce the need and get those laws pushed through. Also, we need to be better at reporting these incidents. Don't just let them slide. Don't be somebody who doesn't want to rock the boat or seem like you're overreacting. There shouldn't be that kind of a culture. There should be the culture of, look, this happened, I'm reporting it, we're putting on record. There's no shame in that, or at least there shouldn't be any shame in that. The more that we document these things, the more we're going to be able to understand the true scope of this problem, and hopefully that will lead to some change. We ourselves can take some self-defense training or learn a martial art like Taekwondo or Krav Maga so that we feel empowered to protect ourselves in the workplace and anywhere in our lives. Plus, it's just great exercise and will get us more fit and toned. We should advocate for de-escalation training and for active shooter drills. And when they are offered, we need to take them seriously and actively participate in them. I participated in one active shooter drill at a facility I was working at as a locums. And while at the time I was like, this sucks, we have so much to do, I can't believe we're having to stop and do this, I can't tell you how many times I've thought about that training and how it made me realize the things I could do to protect myself in those situations. And that includes thinking about how the room is set up. We should be positioned so that we are closest to the door, so the patient is here, we're here, and the door is right by us in case we have to get out quickly. But not all offices are made that way, where they put the counter and where they put the equipment. Sometimes makes it difficult. So it's not always possible to change that around, but do your best. When you can rearrange things, do it. And also just keep that in mind when you're in the appointment, standing or sitting closest to the door. And finally, I want to say we need to get better about having our own boundaries, just as people and as healthcare providers. We don't have to take somebody shouting at us and cussing us out and calling us a stupid bitch. You don't have to take it just because they've paid to come in for a visit. Get up and leave. Tell them it's not tolerated and walk away. Keeping yourself safe and guarding your well-being is arguably the most important job that you have. And I hope that people realize in all of this talk that we are not powerless. Remember, we are the revenue generators. We do have some pull and we do have influence and we need to be using it. Now, you may be watching this and being like, God, this is just another reason why I hate working in medicine. I hate it. I hate my job. I don't know what to do. I've spent all this time and money to get here, and I don't think I'll ever be happy in medicine. Well, if that's you, you may want to watch this video. It's a video I made on that exact topic, discussing what to do when you hate your job in medicine and what are your options. Well, thank you so much for joining me today. And as always, take care, stay sane, stay safe, and I'll see you next time on the Medicine Couch. Bye.